April 11th to the 17th is Black Maternal Health Week. It's an opportunity to further awareness and discussion surrounding racial disparities and inequities in maternal health.
Joining us this morning to talk more about its importance is Dr. Marguerite Braithwaite of Innovative Women's Care. Good morning.
Hey, you guys. Good morning. How you doing? Good to see you again.
What makes this week so significant in terms of awareness and improving the conditions?
This week is a good time to bring awareness and attention to improving the health and health outcomes of Black mothers. They are at increased risk of pregnancy-related complications, morbidity and mortality compared to their counterparts.
Now, what are some of the risks that these women face?
They are 3 times more likely to die in pregnancy compared to their counterparts. And that's really sad because 80% of pregnancy-related deaths are preventable.
What do you think contributes towards that increased rate for Black women during pregnancy?
There's a lot of social determinants that contribute to this, but some of the main factors that contribute to the healthcare disparity nationally would be access to healthcare, underlying chronic conditions, structural racism, and implicit bias.
Now, how is your practice helping to address these concerns?
In our practice of Innovative Women's Care, we try to not only just treat everybody equally, but develop a relationship with your patient, have them have a buy-in with their management of their condition. And when you have a partnership and a relationship with that patient and they feel that they can trust you, it will improve their health and their health outcomes.
Do you have any tips for Black mothers to advocate for themselves?
Yes, mostly, just find a healthcare provider that you feel that you can trust and you can relate to and that you feel comfortable with. Hopefully that healthcare provider will give you some maternal warning signs to look for during pregnancy that can cause, that it can alert you to different complications. You want to make sure that you can give all your personal history and to your healthcare provider so that they can better treat you, and find out any healthcare or support groups that can help support you in your pregnancy and your family members.
Now, when it comes to our own healthcare, we're sometimes our strongest advocate. So is there any kind of tips or insight you would give to someone looking for particular care for themselves? What should they be looking for?
You want to always be your own advocate in your health, but when it comes to pregnancy, there's going to be, especially for Black mothers, are at a higher risk for hypertension, diabetes, preeclampsia. So they should be looking for signs of like swelling in their hands and face, high blood pressure, irregular bleeding, pain over their liver, and just certain things that if they feel any kind of symptoms that they alert their provider so that they know that they can be taken care of.
Are there any other resources for Black women out there who are pregnant who they may not be aware of that are easily accessible for any kind of health benefits? Yeah,
there's a lot of you can always go to your local hospitals for any kind of resources. There's a lot of your doctor should be able to provide you with different healthcare assistance and social assistance that you might need during your pregnancy.
What about when women are looking for a particular provider? Is there anything that they should be paying attention to specifically?
I think when you look for a provider, it's mostly how well you can be able to communicate with them. If you should be able to tell them your full history, let them know everything about you so that they can better treat you and manage you.
And we know you have a great practice, and we know you're very supportive, otherwise you wouldn't be here today. But do you currently have any special offers for our viewers?
Yes, anybody that mentions this segment can get 30% off on 3D ultrasounds.
Wonderful. Well, thank you so much for joining us this morning.
Okay, well, thank you so much for having me. That was always a pleasure.
Yes, we love it. For more information or to schedule your next appointment with Dr. Braithwaite, visit innovativewomenscare.com.